اسمي عبد الرزاق يحيى أحمد الخزان، أب لأحمد طفل عمره 7 سنوات. التاريخ المرضي له بدأ منذ ما قبل الولادة بانسداد فتحة المثانة، وسبب له في ارتجاع
Master Ahmed was born with a congenital anomaly, which we called as a posterior urethral valve. In these children, there is a defect in the urethra, a membranous-like structure, which actually blocks the urine outflow.
تضرر للحالبين والكلى. أجريت له عدة عمليات جراحية في مصر وفي اليمن.
But eventually, at 7 years of age, he progressed to end-stage kidney disease.
كان آخرها في الهند قبل 2 سنين، تكبير للمثانة، واستمرت حالته في التدهور إلى أن وصل الكرياتينين إلى أكثر من 5. ثم بعد ذلك رجعنا في شهر يناير 2024 إلى BLK.
So when he came to us, he was short, he was not gaining weight and height, and his urea and creatinine were very high.
Basically, whenever there is even a mild dysfunction of the kidneys, their body does not grow and their bones doesn't grow, their overall structure doesn't grow. At that time, this child underwent a bladder augmentation with imitrofenol, in which we create a channel via the appendix on the tummy, so that these children can accommodate the urine and empty their bladder by the small tube on a regular basis.
And it was time to start dialysis. But the family took a wise decision to undergo a kidney transplant.
I and Dr. Shafiq, we sat together and discussed what is the way to plan the things further out. Then we told him that post-operative also, there has to be certain norms that this child has to manage. And the father agreed to it.
His mother was the ideal donor for the child.
The surgeon's issue is that the kidney is big for the size of the abdomen. So he has to connect it to the major vessels rather than external iliac or a internal iliac. So that was a surgical challenge.
The mother underwent a donor nephrectomy by the laparoscopy on the left side. And we went ahead with the transplant for the child around 2.5 months before. So with the process, I first took out the right-sided kidney because it was a grossly hydronephrotic, with the fear that the child will have infection in the future. So his transplant went off very nicely. His kidney started functioning immediately. His creatinine became normal. The child is now doing very well. He's growing nicely. His body is actually adapting that thing.
حصل تحسن مباشر لوظائف الكلى لأحمد لله الحمد.
والحمد لله تحسن، وإن شاء الله مستقبله يكون زاهر وبخير.
أشكر كتور شفيق وأشكر كتور أصواتي إنهم طول العملية وعالجوني. أسافر اليمن. شكراً.